Hi everyone, I am Mufida Kabir and I am a British Association for Counselling and Psychotherapy accredited counselor. It is highly recommended that you watch this video as you start your counseling, as this video can help you understand how counseling actually works. Let me start by talking about common myths and truths surrounding counseling. Counseling, despite of how general and common the term is, still surrounded by many myths and stigmatic beliefs which are actually hindering people from accessing it. From many such myths, I would like to discuss four major themes which people, even in this 21st century, believe. One of which is that belief that difficulties are permanent in life. People tend to believe that the problems or difficulties they face in life are a part of life and that they need to suffer it no matter what. This belief stops people from a need for change in life. Another such belief is that you are weak or pathetic if you ask for help. This belief again stops people from actually asking for help and they tend to suffer alone silently. Another common belief is that problems or difficulties in life have to be big or serious for you to seek counseling. This again is a huge misunderstanding. No matter how small your distress is, be it an argument with your partner or any stress at workplace, you can still discuss it with your therapist. Another common myth is that if you seek counseling, it somehow gives an idea to other people that you are a lonely person who does not have anyone to talk. This again is not true. Through counseling, you are actually seeking help from a trained professional apart from a friend or a family member. Despite of all these myths, let's now look at the benefits of counseling. Counseling actually is a talking therapy with a trained professional which includes a lot of benefits. Whatever you discuss with your therapist will be kept confidential and it stays within the counseling room. However, there are certain situations wherein this confidentiality might have to be broken. We will discuss this later in this video. Counseling offers a safe and trustworthy space for you to speak your heart out, where you will not be judged and you will be heard from not the lens of someone in power, but from an equal and genuine human. A counseling session follows an informal format which will be all about you and you will be in control of the session. This means that you can be in control of how deep you want to work and also you can stop whenever you wish to. These benefits make counseling different from a talk with a friend or a family member. To make sure counseling follows a professional practice, it is aided by the BACP ethical guidelines. Let's look into these in detail. Clients are put first as a priority in a therapeutic relationship. Clients should be treated with respect. Clear professional boundaries needs to be maintained in the therapeutic relationship. The therapeutic relationship should be built appropriately in order to benefit the client. Therapists will be accountable for their work with the client and they will be open and honest about the therapeutic process. Therapists will maintain integrity in their work. Anything disclosed by the client will be kept confidential by the therapist. Let us now discuss confidentiality in a bit more detail. As discussed before, therapist is ethically responsible to protect any information regarding the client. Any disclosure of information should be done with the informed consent of the client. However, there might be situations leading to breaches in confidentiality. This can happen in the following cases listed. If a client discloses any information about a potential harm to self or to others, therapist can disclose this information for safeguarding purposes. If a client discloses his or her involvement in money laundering or drug dealership issues, or if requested by the court, therapist is entitled to disclose this information to the legal authorities. Therapist might also discuss the information with the supervisor for ensuring that proper and best service is provided to the client. However, Identity of the client will be kept anonymous in supervision. Let's look at a little more about maintaining boundaries in counseling. Professional and personal boundaries need to be maintained in a therapeutic relationship. To ensure this, the focus of the relationship will be in accordance to benefiting the client. There should be no multiple relationships between the client and the therapist outside counseling. Clear distinction should be maintained between personal and professional life. Therapists should not exploit the client in any ways, for example, financially or sexually. Therapists should not form any relationship with people close to the client. A good professional therapeutic alliance is necessary for change in the client. Hence, it is important that the boundaries are well maintained. These ethics are designed to regulate the professionalism in counseling. However, while dealing with raw human emotions, confronting new situations might involve new strategies, imaginations, or moral values of the therapist. Let us now move on to managing expectations of the client. Before you start counseling, it is important that you gain a clear understanding about what therapy is and what therapy is not. Let us look at what happens in therapy. Therapy offers a safe and confidential space to explore emotional difficulties. Therapy helps you make sense of the world by inviting you to look through different perspectives. It helps you gain a better understanding of yourselves. Now let's move on to discuss what does not happen in therapy. A therapist will not tell you or advise you on what to do. Instead, stays by your side and help you get through your difficulties yourself. A therapist will not prescribe drugs. They do not offer practical help like lending you money or helping you with your traveling or any such kind. Therapists will not meet you outside the counseling room. The therapist will not talk about themselves or disclose any personal information. Let us now discuss a little on the different psychotherapies. There are a number of different psychotherapies provided across the world, some of which are listed here. Mindfulness based therapy, systemic therapy, psychoanalytic therapy, cognitive behavioral therapy, acceptance and commitment therapy, person centered therapy. It is important for you as a client to know your choices in therapy. Different therapies follow different approaches conceptually and technically. Likewise, different therapists follow different therapeutic approaches. I would like to highlight that I use an integrative therapy with a foundation in person centered approach. An integrative approach helps me to view an individual from a more holistic manner, including the different aspects of the person, like physical, spiritual, cognitive, affective, and behavioral. This helps me to combine different theories and apply it in a flexible manner in regard with the present needs of my client. Importantly, I make sure to integrate my therapy in a humanistic way, respecting my client's autonomy and the power of self. Lastly, let us look at how your first day of counseling would be. As mentioned in the poster, each session will last 50 minutes, so will be your first session. During the first session, an introduction to the counseling service will be provided to you. First session will largely focus on getting to know each other, setting therapy goals for us to work on, and preparing a therapy contract. Let us look into contracting a bit more detail. In general, the therapist would be doing the contracting in collaboration with you in order to provide space for you to make any amendments as required. Even though contracting is prepared during the first day, it would be open to revision and changes from time to time as needed. Contracting would cover the number of sessions of counseling and set fixed timings in a week for the total number of sessions. It would also cover any boundaries of time and place of contact between therapist and client. It also covers aspects of confidentiality in sessions. Contracting also look forth to maintain commitment to the therapy by the therapist and the client. This would include attending regular sessions and early informing of any potential cancellations and sticking on to the therapeutic process and goals to attain a positive change in the client. It should be noted that the terms and agreements in a contract can variably depend across therapist, organization, or other contextual factors. We have now reached to the ending of this video. Hope this video helped you gain a best understanding of how counseling works. For any further information and for booking an appointment, please use the contact details available on the poster. Thank you.